Look at that, we're live.
Hey, welcome everybody.
Welcome, welcome. Happy National DPC Day.
I'm Dave Cameron. I'm the Chief Medical Officer of Hint Connect, and so excited to celebrate National DPC Day, the very first one ever. So excited.
That's what I'm talking about. I'm Dr. Brad Brown. I'm the Medical Director of Hint Health, and Dr. Dave and I have done quite a few of these. Haven't had one in a long time, so National DPC Day is a great excuse to reconnect with you, Dr. Dave.
We've had DPC's been around for a long time, so I think it is finally time to have a day dedicated to us to celebrate our community, the progress that we've made, and this is a movement, and there is no turning back. So excited that we are now celebrating that. And part of it is we're celebrating it because we're moving into a time this season where there's a lot of growth. Most of the employers that are interested in direct primary care are really thinking about it with open enrollment. And so we're going to dive into how we can be thinking about working with employers in open enrollment.
Absolutely. And on my side of things, and yours too, Dr. Dave, but a little bit more on my side is the retail, as it's called, just the young families, any individual that wants to sign up as well. I know I'm already getting a lot of questions. Hey, it's open enrollment season. How does DPC work with my company's plan already? My boss is saying this, my HR is saying this. How can it work? So this is a perfect opportunity to break it down from the top.
Do you want to dive in first and talk about your approach to open enrollment, how you work with employers, retail, and some of the things that you talk about?
Sure, why not? I could talk about this all day. Like I said, getting a lot of questions about how do I work with your clinic? How do I sign up with your clinic if I already have insurance, but open enrollment's coming, premiums are going up? How can we see you and the other docs at your clinic, but not, is there a way to roll that into my benefits already? And yes, there is. That's the short answer, right? So if an individual or a family comes to me and say, hey, what can we do? Say, yeah, talk to your HR person. If it's a smaller company, talk to the boss, see how we can work that in. But when it comes down to it, a lot of families are choosing to go out on the open marketplace and find options that way, and then pairing it with DPC as opposed to doing an employer-funded plan. Just because those are, everything's getting more expensive. So they're shopping around. People are shopping around trying to find what is the most affordable and best care out there. And so us being a resource, us and you and other DPCs of like, hey, we can be a soundboard for you. This is what we've seen other people do. I found is really, really connected with people, right? Like, oh, this is what other people are doing. They're some of your patients or some of the patients of the clinic down the road. And this seems to be working for them. Maybe it'll work for us too. So it's really fun to try to play that game. It's almost the non-medical piece of DPC, right? Of how can we help change the American healthcare system for the better and change the world for the person sitting on that couch right there.
Well, and especially as we've been reading the news where the Affordable Care Act premiums are going to be skyrocketing in January, I think a number of people are starting to rethink what their strategy is, whether they're an employer or a small business owner, or if they're an individual that is purchasing an insurance or a health share, and thinking through like, how can I cut my costs? And so, frankly, I think it's really important for us as DPC clinicians, practices to be involved in that conversation. I have never thought of myself as a benefits advisor, but I have more conversations with people saying like, I don't know what to do. I'm spending too much money. What do I do? I mean, I'm happy to tell people what I do for my specific family or our practice. But I tell people I'm not a benefit advisor, but I'm happy to give my 2 cents. I don't know. I have to be careful not to overstep my bounds though.
Same here. That's literally the exact same disclaimer that I give. I'm like, hey, I'm not a benefits advisor. This is what I've seen other people do that see us. This is what we do as a family personally. Yeah, I wouldn't say it's a fine line, but you want to be respectful. You want to make sure that, and expectations, you don't want people to think that you're a benefits advisor or that you're selling insurance or anything, because that's definitely not my jam.
Yeah.
So.
Well, and I know a lot of patients, especially patients that are working for an employer that offers a direct primary care benefit or is going to be offering a direct primary care benefit, they've never heard from a doctor. Like That is unheard of for them to go to an open enrollment meeting and see a doctor. That's so rare. And
Yes.
I think the most important thing that we can do is go to those meetings. I mean, I know those meetings are boring, but if you go to that, most people, when they're looking for a DPC benefit, what they're doing is you're really buying. They're looking for that relationship, and so it's not just you going there to explain what DPC is, but it's kind of like doing a meet and greet with a lot of people.
Absolutely.
Normally, when you're doing a meet and greet, it might just be with one person or a family, and so I find that the open enrollment meeting can be particularly helpful because it makes my ability to do more meet and greets all at the same time. It's more efficient with my time.
Absolutely. I love that. There's so many good things about those open enrollment meetings. One is most people don't know about direct primary care, right? And so it's like Henry Ford said way back in the day, if I asked people what they wanted, they would have said a faster horse, right? And so they go to these open enrollment meetings. What are people asking for? They don't know. And so we need something else. We need that presence, like you said, being the doctor there and saying, hey, this is what DPC is. Then all of a sudden, all these employees are asking their HR departments for it. There's this huge groundswell, huge demand, and DPC just explodes. And I'm really happy, and I go to bed happy at night because of that.
So what's your elevator pitch when you're at these meetings or when you're trying to share direct primary care with someone who doesn't know about it?
Oh man, read the room first of all. I try to read the room. There was a great talk at DPC Summit at Rosetta Fest a couple months ago about you have the same general framework for your elevator pitch. I'm making this a long answer, Dr. Dave. Okay, I could easily give my elevator pitch, but knowing what type of generation that you're talking to, the older generation, maybe the Medicare or pre-Medicare age, how you phrase things is a little bit different than the early 20s, maybe early 30s generation. It was a fascinating talk. If anyone can watch the recording, I highly recommend it. But basically, maybe the older generation values a little bit more loyalty, in-person connection piece. And then the younger generation is more convenience, text, phone calls, things like that. And so I always like to see who's in the room, who am I talking to, who am I on the elevator with? Yeah. And then kind of gear my pitch towards that person. Because, a 25-year-old who's recently out on their own working, they're just learning how to be an adult, And so pitching to them like, hey, you're busy, you're on the road, just shoot me a text. Here's a video of my cough, or here's a picture of my rash. And they love that. Whereas, some of the older generation are like, I want to come in every time. I want to be seen in person every time. You can get in same day or next day. I'm your doc, forever from here on out. So my elevator pitch is basically, convenient, affordable, accessible, unrestricted access to me as your doc. I know you, I know your family, I know your dog's cousins' names. Everything is wholesale cost. Everything's transparent. It's very upfront, and it's a new spin on how primary care used to be. I work for you as your doc, right? I don't work for an insurance company in 3,000 miles away in a cubicle telling me how to practice medicine. Within the realm of the recommendations and safety, let's take care of you sitting on this couch, right? Let's see what we can do to get you to your health goals and live a long, healthy life. So another long answer, sorry. I want to hear yours. I love your elevator pitch.
Well, I'll tell you, I've made a lot of mistakes, and I used to really try to pitch saving money to patients and employees. And I've really found that they just have never believed me. And so because they heard, everyone hears so many people say, hey, I'm going to help you save money. So I actually I've taken that out of my elevator pitch. I really have three things that I focus on. The first thing is experience. You're going to get wowed by this experience. It's going to be like a small town 1950s doc that's high tech, and you're going to love it. You know what? I actually feel really comfortable just being bold and saying, like, this is going to be the best healthcare experience you've ever had. The second thing is I just say it's a membership model. It's simple. It's kind of like a gym. You come in there as much as you want. You can do virtual or in person. And then lastly, like you mentioned, all inclusive. In-person, virtual, 24/7 access, everything within my four walls is included. If it goes outside, then we're going to use your insurance. And I try to keep it down to those three things. And I try to keep it 30 seconds or less. Talk about just experience. And if anything, I brag a little bit about is the experience. I think we all should brag about the experience. Don't undersell, because this is better healthcare than you're going to get anywhere else. So I don't undersell yourself with the experience. Just say, hey, it's a membership model and it's all inclusive. And I think you don't have to sell it. It will sell itself.
That's the key right there. It sells itself, right? That's why there's the demand for it. That's why there's a groundswell with employers and families and individuals, is because word's getting out that it's amazing. And yes, I'm biased. Yes, you're biased, but who cares, right? The bar is so low in primary care to exceed expectations. The expectations are way down here. You don't have to do much to exceed the expectations. If you're just a normal, happy person that loves going to work, that bleeds on people, right? Not to be too weird and medical, but that shows. And you love your job, people see that you love them as well. You want the best. It's like, okay, yeah, absolutely. I want to align myself with this person. So that goes a long way. I love it.
And then I love it then when they come and say, wow, after being here for a year, you wouldn't believe how much money I've saved. I wait till they tell me that they've saved money, and then they'll tell other people that they've saved money. And
absolutely.
I think that's the way to talk about finances. Let someone else tell that story.
Yep. Let them experience it on their own. No doubt. You sometimes my nurse will politely send them a text if they go to the ER, or if we avoid an ER visit, and she'll say, "Oh, thank goodness you didn't have to go to the ER and spend $5,000." And just leave it at that. It's like, I love.
So you're reminding them, yeah.
Yeah, I love when she does that. It just cracks me up. But anyway,
and we also got to make sure that people know that this is for other family members, for kids, for spouses, and whether. Sometimes, the spouse won't be attending that open enrollment meeting, but making sure that there's a link or a video or something like that they can be able to see, so we can be able to attract the other family members.
Absolutely. Yeah, no doubt. So what have you seen on the larger employer side, on the Hint Connect side? What's the trend for next year?
Well, I think that we're having a huge uptick. I think there's a couple tailwinds. One with the new laws with HSAs. So employers that were hesitant to add a DPC benefit because of HSA restrictions are very interested in that. Plus, I think that Hint Connect is a national network of direct primary care practices that employers can tap into all of those practices. The fact that Hint Connect is so large that the geographical reach is at a point now where we can be able to offer 80% plus of all of the employees a DPC within 15 miles. So I think that is really exciting. I know we quadrupled in size over the past year, and so we're really excited about the growth with Hint Connect. And if you're thinking about starting up a direct primary care practice, or if you'd like to add some more patients, reach out to myself or Beth Holmes or one of the other teammates, so that we can add you to the network.
I will say, as a testimonial to that, before I was ever affiliated with Hint, I met with G and the Connect team and got all signed up. It's painless and it's free for docs, and it is another way. I like to see it's a way to diversify new patient streams. Right? We always want to diversify our revenue streams, but how we get new patients in our practice from a business standpoint, it's a way just to get new patients, and a way for people to feel DPC and learn about DPC when they otherwise wouldn't have. So
yeah, I think that's really important, because there have been some times where a DPC practice has too many patients from one employer. Yep. And if something happens with that employer, they don't continue. It's much more important to diversify, so that if you lose some patients from a specific source, that doesn't cause a significant problem financially with the practice.
Yep, no doubt. Absolutely. No, I'm excited to see over the next 12 to 18 months the adoption of direct primary care with medium to larger employers. My practice, we haven't really needed to go after the huge employers. I haven't really had the bandwidth for it. So we kind of stick with the local HVAC trades, landscaping, restaurants, hair salons type of size. Yeah. Less than 10 employees, maybe less than 15. We have one that's a little bit larger. are profitable enough to where they can provide some type of benefit, but they don't have enough revenue to provide a full suite of benefits on the marketplace. So that's another fun thing that I can offer of, hey, restaurants, you have a really high turnover in your staff. Like that's just naturally in that space. And so we found that when we pair with restaurants, then their turnover goes almost to zero because they love the DPC benefit. And so we found that it's the pitch to them is, hey, your most expensive line item is training new employees. And so for $89 per person per month, you can basically hold on to those employees and let us take care of them. It's pretty cool to see that. It takes a little bit of training. But
well, your experience goes along with all of the studies that have looked at churn and the reduction in turnover, that some of them have had ranges depending on what sector, but there's a 5 to 30% reduction in turnover for those that are offered a DPC benefit versus those that are not. And not only that, there's also a decrease in absenteeism. So there is a 10 to 20% fewer missed sick days for those that have a DPC. And that's been found in numerous studies.
That is awesome. I'm going to start using that data. I didn't know those.
Yeah. So, one of the things I think with larger employers, I think the most important thing is you got to have the employer leadership buy-in. And if they can get all of their employees in one room and then they meet the DPC doctor and they can all hear it at the same time, that will help getting people signed up. And it's very difficult to bend, or I should say, you can bend the cost curve for their spend for a self-funded employer if you get patients both signed up, so we call that enrolled, and then engaged once they've actually had an interaction or an appointment. Then it's sticky. When people have experienced direct primary, it's sticky, and then they start using DPC and they stop using all these downstream resources like emergency rooms and unnecessary expensive places. And that's where they can really save money. And so I think when you get an employer that is bought in, that believes it, that is saying the same message that we are, that this is high value, that this is going to give you great care, and it's going to give great customer satisfaction, partnering together with the employer that way, that's where you really get successful.
That's so good. Yeah. I've had a couple employers say they want that hard data, wonder if we could provide some data on that of like, hey, this is how much we could save down the road just to have a stock thing. I know there's a DPC playbook that Hint puts out for starting up. I wonder if we could add that almost like an employer pitch playbook. That'd be awesome. A chapter, if you will.
Well, one of our employers, I'll just give you some of the data from one of our employers. This is from 7 years ago. There was one employer, this was data after 2 years. They had 55% of the employees in direct primary care, and that was 165 patients. Their customer satisfaction was exceptional. The net promoter score was above 70%. There was a 31% reduction in ER visits over 2 years. So they looked at, usually year one, the claim savings is not as robust just because there's a lot of people that need to get their colonoscopy, their mammogram, and all that kind of stuff that drive costs a little bit more. But overall, after 2 years, there was a 30% reduction in medical claims. Compared to non-DPC, there's an 8% reported improvement in overall health. And then this was fascinating. 92% viewed their employer more favorably because of having that DPC benefit. So, they're pretty huge. There's some things that are hard cost savings, others that are more soft. But I think that, and this is just one study. There's numerous ones, and you can take a look. There's a whole bunch of studies that are in the repository. But I think that it's going to become clearer and clearer and clearer over time that these studies are consistent, and we're seeing the same benefits from employer to employer.
No doubt. We do have a question in the chat. How do we connect with the team to discuss increasing patient volume? That's a good question. A couple different ways I can interpret that. I'm assuming through Hint Connect. Is that right, Amy? How can we connect with the Hint Connect team about increasing patient volume? A lot of times that is, we just need more employers to sign up, and then they have employees in your catchment area, and there will be more that trickle in. And the patients, depending on the employer or how it's set up, can choose you. If there's a bunch of Hint Connect providers in your area, they like to see, the patients like to see who they would choose, if you will, to go see. So that would be the easiest way. Just get a lot of employers to sign up, right, Dave?
Well, I think some of this is like how do we? I think the question is how do we increase our patient volume? Is that maybe the question?
Through Hint Connect. Yeah.
Through Hint Connect. So one, you can join. So someone asked what my email address. It's david@hint.com. And you can reach out to me, but I'd pass you along to our team to get you signed up. But feel free to reach out to me. Or here, Beth said we can reach out to hintconnect@hint.com. And then I'm sure we can give you a list of all the studies. I'd have Beth do that. But I think that direct primary care resonates with employers. I just think that because for employers it is the number 2 expense, that they're nervous. I think employers are nervous about potentially adding on an expense to hopefully lose or decrease their spend at the end of the year. I think that's the fear. And I think as we get more and more data, I think more employers will be willing to take that risk. And I just think that, we can partner with them and get the word out. I don't know if you have suggestions about how to get the word out.
The long game is just keep being the best doctor and physician or NP or PA that you can be the best provider, clinician, because word does get out. I've had a couple patients that have signed up just on the retail side, and then they go and tell their employer, and then the employer, we meet with them, and then they sign up to the rest of their employees, right? And so if you're a good human, which we all are, right, and a great clinician, then word does get out. If you live the DPC mindset of, hey, let's change primary care in America, then it's all brick by brick, little by little, and supporting each other is fantastic as well. So that's kind of my 2 cents.
And I think DPC dovetails so nicely with health insurance plans that are high deductible or self-funded plans in particular, because insurance, like when I buy insurance for like my life, auto, home, or disability, it's for the unexpected high cost events. It's for the surgeries, the hospital stays, specialty care. Why in the world has primary care ever been run through insurance? It makes no sense. Nobody ever uses insurance to pay for their oil changes. I mean, it makes no sense. It's for the crash. And so direct primary care is ideal for keeping you out of those unexpected high cost events. It's there for the day-to-day. And I kind of think of as the DPC as your daily health partner, and insurance is the safety net. And I really think that insurance needs to continue to morph that direction and get back in line with other insurances like life and auto and home and disability, because otherwise it won't make sense.
Yeah, no doubt. I say we have one more question, and then we'll give a plug for Hint Summit. How about that, from Rachel?
Sounds good.
How do you approach small business employers? What's your favorite tactic? Touched on this a little bit earlier on, but first of all, the sales cycle is a little bit longer sometimes with these small businesses, where it takes, like Dave said, it takes a little bit of training and thought process of, okay, I'm going to spend money to save money. My favorite tactic is, first of all, before that, getting to the decision maker can be challenging as well, because a lot of times in these small businesses, less than 25 or 30 employees, the HR department is the boss, like they're the owner, right? And so finding that person is, whether that's at a networking event or in the street or at a kid's soccer game or something. Favorite tactic is kind of like your pitch, Dave, of showing the value as opposed to telling the value. Getting in the room, I like to try to get in the room with the employees, with the boss there. So I've done this probably maybe a dozen times. I'll say, hey, when do you have an all hands team meeting with everyone there? I'll bring everyone breakfast or lunch, whenever the meeting is. Like, I'll bring them. I'll just chat about what direct primary care is. Like, oh yeah, absolutely. Everyone loves free food, free coffee, whatever it is. And the close rate on that is pretty high.
Yeah.
It's a product that sells itself once you can get into the DPC side of things. So, but small businesses love the data of, hey, your turnover is so high. We have a handyman company that when their guys aren't working, they're not making money. So one of the guys, he slashed his hand open turning a wrench on a washing machine. He came in, he was in and out with stitches in less than, I think it was 34 minutes. As we clocked it. Door to balloon time, right, Dave? Yeah, door to stitches time. Showing as opposed to telling goes a long way. To say, oh wow, yeah, he was back on the job 40 minutes from when he left that washing machine, and he finished that job that day, as opposed to $500 in urgent care, and then he had to go back the next day. Happy customers, happy employees. It's again, a product that sells itself.
I find that a lot of my small businesses that join started off with the business leader being my patient. Right? They got a taste of it and they're like, oh my gosh, how can I get this for my whole team? And then we just kind of work with them. Sometimes they have to work with our broker, and sometimes that can be a little challenging. But I think the main thing is they got to experience it. And some people don't like this strategy, but I think sometimes if you want to give someone a trial membership, for a few months, just so they can know what it's like, or give them a discount. But I think that's really helpful. But overall, I'm excited about National DPC Day, because where we are going, we're not going back. There is growing recognition that this is a strategic solution for employers, and we're just going to need more. My biggest fear is we're not going to have enough direct primary care doctors fast enough for the demand. That's what I think is going to happen. And so we got to start talking to more med students and more residents and telling them, hey, time to join.
Absolutely. Avoid the burnout entirely. Just come join the light side, not the dark side. Just kidding. Also, quick plug for Hint Summit. It's in April in Nashville at the National Country Music Hall of Fame. 10-year anniversary. It's going to be a massive, it's the biggest, best one yet. I cannot wait. I love Hint Summit every year. It's, we all go to these CME conferences, which are great. You connect with people, you learn some things, you get some CME, but the Hint Summit being the innovation conference for DPC and being a 10-year mark, it's already going to be, I've seen a little bit behind the curtain. It's going to be phenomenal.
Sounds great. Well, thank you so much for the conversation today, Dr. Brad.
As always, Dr. Dave, can't wait.
All right. Hey, thanks for your time today, and have a wonderful day. Happy National DPC Day.
Woo.